The blessings of Dr. C.N. Purandaresad, let's start the ball rolling. We are happy to have Dr. Archana Verma ma'am among us, who has agreed to participate in this webinar in spite of her busy schedule and festive season. Dr. Archana Verma ma'am was the Vice President-elect FOXI 2021. He was the founder president of West UP chapter, organizing chairperson UPCOG 2020, organizing secretary North Zone Juba Foxy 2016, organizing secretary UP ISR 2015, President Foxy Best Committee Appreciation Award, UP Governor Uttarakhand Governor Appreciation Award for Menstrual Hygiene, Women of the Year Health Award for IAS, Wives Association, and faculty in more than 600 national and international CME. Dr. Archana Verma, ma'am, the stage is all yours.
I'll just interrupt for a moment. I always say that we should introduce people by saying something which is not on the screen. Dr. Archana Verma has an infectious smile and a heart of gold. And wherever she goes, she makes people very dear to her and extremely popular.
Thank you, Dr. Bhaskar. Sir, and it's my proud privilege. Soma, you please present my PPT.
Yes, yes.
And first of all, I just want to say, instead of I'm not busy in festivals, actually some family functions going on. So that is why. So Dr. Bhaskar Pal, I just want to say that, the wisdom is something very different from the knowledge, and the knowledge and something only a wise person can know how the wisdom is associated with spreading the knowledge. And only Dr. Bhaskar Pal could think of that in such a shining, as the name suggests. And we all know that this a wise concept of taking up a common problem, which is such a basic as the vomiting in early pregnancy. And each woman who is getting pregnant has so much of, I'm audible now, sir, Dr. Bhaskar, sir?
Yes, yes.
Shehla? Yes. So it's but common issues to all is nausea. Whosoever, they all have their experiences, they all have their stories, but so they have. And Dr. CNP sir has very rightly said, we must remember his golden words, that sustainability is something which is much needed, and we all have to think of that. Not only just coming in, we all know that Dr. Bhaskar Pal is shining as a Surya Chand. They say like his name is like Surya, so he will not stop shining even after his presidential election, and he wins and he leads. He will. So now please, now let's start. So next please. So this we know that this nausea in pregnancy is not only 40%, 30%, it is about more than even 80%. Just like anemia, it's running in every patient suffers, and that is why this is so important to know this. Next please. And this nausea and vomiting pregnancy, it is actually because it is not only morning sickness, it is anytime, any day. So that is why in affecting the patients, in majority, they start having from 4 to 9 weeks of pregnancy. And this, thankfully, the symptoms subsides, but somehow 15% of the patient, their symptoms continue even up to the 20 weeks. Next, please. And this nausea and vomiting is only nausea is generally about 80%, and this vomiting and nausea together are 50%. And one of the rare phenomena is a hyperemesis gravidarum, which is about roughly 1 to 6%. And in Indians and Asians is somehow very common, so we are much concerned. Next. Please. And so that we all must know what are the risk factors, and because whenever the patient comes to you, every obstetrician faces this. So the patients are younger and under and overweight, both type of a patient, multiple pregnancy, molar pregnancy, GIT disorders, and socio-economic factors, something very, very important, because it is much more in the lower education pupil and the poor people, and they are the main sufferer and the burden is on them. And that is why with the anemia, they develop, and with the vomiting, they develop anemia and all the complication of the pregnancy and the FGR also. And this sometimes related to the genetics also. And in some, though I won't say this people say, common people say that somehow it is more seen in the female fetuses also. And there is a family history of hyperemesis gravidarum, or in the previous pregnancy, if there is a hyperemesis, then the patients generally suffers from 15 to 20%. Next, please. And there is no measure which can, next please, this for the assessment of the nausea and vomiting in pregnancy, because as such there's no lab test which can say what is a grading or ultrasound. It is only visual and somehow the symptomatology dependent, and this score is called PUQE, is pregnancy unique quantification of emesis and nausea. And there are three, it has three items. Number one is a nausea, number two is a vomiting, and number three is a retching, depending on the how much time in the per day they are getting it and the frequency of this. And this normally the score ranges from 3 to 15, and if it is more than 13 is a definitely severe case of hyperemesis gravidarum. Next please. So how to diagnose hyperemesis gravidarum? So that is something, because this is detrimental and it need to be recognized and treated. It has adverse maternal and the fetal effects also, and there is a associated with is a weight loss, dehydration, electrolyte imbalance, and generally all of the above. Next please. And the factors responsible for the this nausea and vomiting. There are many factors, but somehow there's no single factors which can be taken that this is important for the nausea and vomiting. And it is sometimes metabolic and the hormonal stimulus, because it has been seen that wherever there are chances of more of the human chorionic gonadotropin hormone, the chances of vomiting are more, but it is more researchers are needed for this. It is not controlled, because in molar pregnancy, twin pregnancy, where the level of the acid is high, the vomiting is high. And then there's a immune system dysregulation, and gastrointestinal motility is also something very important, because this vomiting and the tendency of that this progesterone hormone impacts, and H. pylori infection also causes. Next please. So the etiopathologist, there are many ways where this vomiting can occur, because vomiting reflex is something, and but there's not even a single cause, and this stimulus, this a trigger, this it's not very common, it's not least understood, and it is sometimes the vomiting center is stimulated directly or sometimes indirectly. Sometimes even the thought process or even the smell can produce it. Next please. So it is something little complicated and level to understand what are the triggers for the NVP. And so there is in this all the system, this vagus nerve system, and there are certain receptors and the precipitants factors. Next please. So which complementary treatment? So that when the patient, it's important to know is the awareness, something I want to say, because I'm mainly interested in awareness point. And when we counsel our patient and we make them aware that when they should report to the OB and gynae care provider, that is something very, very important. When the frequency of the vomit, they should not take it very normal, because generally the mother-in-law says, ये तो होता ही रहता है, ऐसा तो हमारे टाइम में बहुत ही होता था. We were not able to eat, we were not able to talk also. So, but that is not there. Frequency increase, if there is associated weight loss, they should report. And if there's a blood in the vomiting and this feeling of hopelessness, this is something very important. If the patient is at home and this feeling of hopelessness, even the suicidal tendency, and even to thinking of aborting the pregnancy that comes into the mind, and there's a fever is associated or abdominal pain is associated, and there's a less urine coming out, that is a sign of a dehydration, they should come to the doctor. And there are certain, because when we are treating the diagnosis, after diagnosis, we need to treat the patient. So for the treatment, there are many complementary, even recognized by the World Health Organization also, that we recognizes these options which are available, that ginger and this vitamin B6 acupuncture. This is something I always used to think that this is something either Chinese or Indian, but I have just read that even Canada and all guidelines, RCOG guidelines, also accept that this acupressure is something which is again beyond medication, and it really helps. So next, please. And the goal is to make the symptoms tolerable. Just remember, we have to counsel the patient that these symptoms are not going to be avoided or completely treated, and they have to make this reasonable quality of life is improved. That is our aim, and so we must keep on counsel them and treat them and help them. And good care is very, very important, and good behavior is also sometimes very, very important, because these are the patients who call you round the clock. Next, please. And then this management of, this is a chart flow, something simple. And this, when there is a mild NVP, there's a mainly it is said that dietary and the lifestyle modifications are something very, very important, which we need to tell patient that the small frequent meals, 6 meals should be taken instead of 2 or 3 meals. And then there's a high protein and carbohydrate diet, less of spicy, and consumption of fluids with electrolytes is also recommended. Small frequent in between, so she is not dehydrated, and adequate rest is also there. And something important to avoid is the empty stomach, and then stay well hydrated. And fresh lemon and mint is also something gives a good feeling. And and avoid triggers. That is also in preventing the vomiting. What triggers are there? Certain food items, cooking, and the sleep well, and less of exercises. They should not do excessive exercise. When the moderate vomiting in pregnancy is there, along with the complementary, then the pharmacological medication is needed. And then there are many medicine, first line, second line, and third line. And the severe and nausea and vomiting, that is the hyperemesis gravidarum of severe type, then the patient need to be admitted, and they have to be given the certain nutrition supplement, and the IV fluids system is also given. Next, please. So this shows this treatment ladder for hyperemesis gravidarum, taking the what should be given first and what should be done second. And among this, the cyclizine, they said, is quite effective, and they can give domperidone is also, then ondansetron, and the steroid therapy for the last and the very late stages of hyperemesis gravidarum is advisable. And this is either you can give orally, and sometimes hydrocortisone is a choice, where the patient is IV fluid is going on and there is less of acidity, and then later on the patient can switch on to oral prednisone once the oral fluids are tolerated. Next, please. So there are so many guidelines for this to take care of the this nausea, vomiting, pregnancy. This RCOG guideline, Dr. Bhaskar Pal will say, what Archana is talking, I am the master of the RCOG. So, but there are, I will just say a few words, that community care is advisable in the mild cases, and the patient can be treated at home. And then there are certain the daycare center, daycare therapy is advisable with certain medication and lifestyle changes, ambulatory daycare. And then the admission is advisable in patient management, where it is considered that the patient has having continuous nausea and vomiting, and this confirmed or suspected comorbidity, or like urinary tract infections, or inability to tolerate antibiotics also. So next, please. So this is guideline 6.9, which is this thing we should know. So this also says that safety and efficacy data. How safe are the antiemetics, we should know. And this combination of different drugs should be used in patients who do not respond to a single antiemetic. So we should not say that we are giving doxynate. Generally, we give this combination treatment, and when patient comes, we directly advise sometimes meniperinum also, but we should know what effects is that. There is a risk of extra paradigmal effects, and it should be used as a second line therapy. And then ondansetron is also safe and effective, again, because the limited data, it should be used as a second line therapy. And diazepam as such is not recommended, we should know, because sometimes we see the patient is feeling restless, and then we tried sometimes it is hard that they try to give the diazepam. It should be avoided. Then next, please. And then, so the first line, second line, third line, this chart is very, very important. We should note this. And because, and in this, we just see that all the motion sickness medicines are recommended. And they say, even in India, though we are using mainly this pyridoxine, vitamin B6 mainly, and doxycycline. So, and but cyclizine, prochlorpromazine, promethazine, and this dose is also, I think this chap, if I don't want to rectify everybody, but this chart is very, very important. And a third line, instead of giving directly patient in steroids, we should take it as a third line. Next, please. And inpatient treatment, whenever we are giving a IV fluids, remember to give the normal saline first, because as such, there's no role for immediately for the dextrose. It should be given as a second choice whenever you are trying to give the thiamine injection or infusion. Though I have never tried giving it, but normal saline we always prefer. Next, please. And this other recommendations and monitoring is also very, very important, along with the complementary therapies. And then this counseling is also very, very important. Next, please. The ACOG recommendations are also saying the same thing, that prophylaxis point of view, this standard recommendation is to take prenatal vitamins for 3 months. This is a prophylaxis. We have to counsel that if you take prenatal capsules for 3 months, you will be having less of vomiting. And the important is the treatment of nausea and vomiting of pregnancy with vitamin B6 and doxycycline. Doxylamine is safe and effective and should be considered. And in patient with hyperemesis gravidarum, if the patient is of hypothyroidism, the low level of thyroid stimulating hormone, we should be very careful, and we should be giving avoiding too much of other medicines also. Next, please. So the this Canada Max guidelines also say same thing, that what they say, one thing very, very important, that sometimes a patient is having vomiting, avoid giving or discontinue iron containing vitamins along with it, or substitute it with a folic acid. This is really important. And this somehow that the cetirizine, fexofenadine, and loratadine, they should be avoided, though they are very helpful, that they may cause a heart block. So this is to be remembered, because later on we have to we are answerable to the patient. Next, please. So because the nausea and vomiting, I'm sure I'm not making everybody feel asphyxiated and nauseated with my talk. So it's in summary, it's the last I want to say that please just remember that counseling is very, very important. Awareness is very, very important. And monotherapy is to be switched to another therapy. And all the clinicians should use only those medicines which they are familiar with or they have experience with it, and not just blindly doing it. So thank you very much. And thank you, Dr. Bhaskar Pal, sir, for giving me the opportunity. And I'm really thankful. And this nausea and vomiting, if taken care, this is also one of the respectful maternity care. And all patient, even we were patient at once upon a time, and we know what we expect from obstetrician. And so I think I've done the the basic problems simply nicely. I will say myself nicely. So thank you. And thank you, Shaila. Thank you, Shoma, for giving me this PPT and making it very nice for me. And thank you very much. And this is for the first time I'm talking in front of Dr. Bhaskar Pal. Oh my God, he's such a great guru. And so I think I may not be doing justice to the subject, but I'm very, very happy and satisfied, just like anybody, any youngsters. So, and there is giving me chance for a more research and data. So I will be doing this thing as Dr. CNP sir said, because if we do this simple, so I think that like if we should always start with simple. Even our Prime Minister say, you don't need to do too much big. Even small things are really good. No, sir?